Welcome to Clydehouse Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options. My guest today is Dr. Mac Harmon, the Surgical Director of the Children's Healthy Way of Buffalo, located at Oishei Children's Hospital. In this episode, part 2 of our 2-part series on childhood obesity, we'll be discussing surgical treatment options. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. Harmon. Thanks for joining us.
Thank you.
We recently had your colleague, Dr. Majumdar, on to talk about the Healthy Weight program. So if we can have you talk a little bit about the patient's journey and how they end up into that program, how someone goes from their primary care doctor or the pediatrician into the program.
The best way it happens is for the pediatrician to recognize that there's a problem and that the patient is not healthy in part because of obesity. Mm-hmm. And then the pediatrician would refer to our multidisciplinary program.
Okay. So when it comes to Western New Yorkers, is there a higher prevalence in this area of the country? I know you've worked in other places. Talk a little bit about our community and if there's a higher prevalence, and if so, is this the reason Healthy Way was created?
Well, I had started a similar program in Alabama in 2004.
Okay.
There's a real problem with obesity in the Deep South.
Sure.
And when I moved to Western New York, a little bit to my surprise, it turned out that there's a similar problem in Western New York.
Okay.
And so we quickly established the notion of creating a similar program here.
Okay. And then what would that entail in terms of creating the program? Just because it seems like there had been different entities in different parts of the hospital or the community that were working on this initiative. Well,
the key is for it to be multidisciplinary and a dedicated team. So we created a team of nutritionists, psychologists, exercise physiologists. Dr. Majumdar is an endocrinologist by training, but also a bariatrician. Mm-hmm. And I've been in the pediatric or adolescent bariatric surgery business since 2004. So I just replicated what I had done before, and it's a fantastic program.
So you talked about the program itself as a whole, but towards the end of the spectrum, we're talking surgery, which probably is the last option, I would guess.
I call it the last door on the hall.
Okay, so when you get to that last door, let's rephrase it. How do you end up getting to that last door? Why is surgery the last option, and how does one end up there?
Well, it's not just a weight issue. It's complications of the obesity that we're trying to fix. It's not just trying to help you lose weight. It's trying to help fix your hypertension, your sleep apnea, your problems with your triglycerides, your liver disease. And so all of our teenagers that we've operated on have those comorbid conditions as a target for the therapy.
Okay. And so those comorbidities, what can they do to someone? Because often you hear those types of comorbidities in, adults or seniors. So if you're talking about kids that are 8, 10, 12 years old, what can they do for their health or their lifestyle?
Well, you can imagine these conditions used to only be found in adults. It used to be called adult onset diabetes.
Sure.
And now it has to be type 2 diabetes because it happens in our children.
Right.
And so the average BMI, which is body mass index, which is a measure of your weight and your height, normal is 25. The average patient who gets surgery, it's 50.
Wow.
It's at an extreme. And 70% have sleep apnea. And all of them have glucose metabolism problems. So it's an extreme subset.
Okay, so not only is this surgery life-altering, most likely it's probably life-saving, I would think.
It can be. This all came about because pediatricians back in the 1990s when the obesity epidemic hit, who were specialists in obesity, were seeing their patients die before getting to adulthood. Sure. And so they reached out to some surgeons to say, hey, is there a role for bariatric surgery in these patients?
Right. So what is the actual surgical treatment that you'll perform?
Currently, there are 2 options. One is the one we know most about, which is called the gastric bypass, which makes a small stomach and then attaches the small intestine further downstream so you can't absorb all the calories. And then more recently, a popular operation has been the sleeve gastrectomy, which is what we've done mostly. If that fails, you can still have the bypass later on.
Okay. Which one's more invasive? Which one is easier in terms of recovery?
Well, sleeve gastrectomy is less complicated than the gastric bypass. and has a quicker recovery. But the average patient here in our program loses about 100 pounds in the first year.
So that's some of your success rates when you talk about the average weight loss. But it's not just losing weight. I mean, there's a whole lifestyle change that you'll need those patients to go through.
And in fact, the operation forces the lifestyle change.
Right.
If you eat too much, you throw up. If you eat the wrong thing, you get sick.
Sure.
And it sort of forces you into a healthy eating habit. And then as you lose weight, you can exercise better.
Okay.
Many of these children have joint pain. And so as they lose weight, they can then do the exercise that we need them to do. And so the operation sort of wears off after a year or so. So they have a year to make that lifestyle change to continue on to be healthy.
Sure. And is it tough for these patients to undergo that lifestyle change and to really make those major changes in their life?
It is hard, but they have at least a year to get there.
Right.
And so many of them do. Many of them, as the effect of the operation wears off, continue to lose weight and continue to be healthy. Some regain some weight. No question about it.
Sure. So the surgical treatment is, I guess, as you referred to as the last door. What do you do to help encourage patients and their families to prevent all that? So in terms of being the last step in the process.
So they have to be in our program at least 6 months before we offer the surgery.
Okay.
Some a year and a half.
Sure.
So we fight really hard to get them to lose weight, not with surgery, but with behavior modification.
Sure.
And I remember one young lady from Rochester who came to our clinic very fired up about the surgery. And all of a sudden, at the end of 6 months, she had lost 50, 60 pounds. And she said, I guess not.
Sure.
So we celebrated.
Sure. And talk a little bit, if you can, just what are the components? So I know you talked about, you're the surgical component, but there's also the primary care part. There's a psychologist. So what else is involved in the program?
Well, when they come for an appointment, they get seen by all of those people on that multidisciplinary team. So the nutritionist has a plan, the psychologist has a plan, the exercise people have a plan, and we really individualize the plan. It's not one size fits all. It's a family-based plan too. So you have to have the family involved, and the mom involved, and we try very hard to modify the behavior that's gotten them in a bad spot before they get to the last door.
Sure. Well, Dr. Harmon, in wrapping up today, if you can, if there's people that are out there watching, what can they do to learn more about the Healthy Weight Program, to learn more if they have questions about their family members?
Well, we have a website that's probably the easiest way to access that would have all the contact information and describes the program and the people on the team.
Okay. Well, thanks for joining us today. We appreciate all the work that you're doing at the New Children's Hospital as well as with the Healthy Weight Program.
Thank you.
Thank you. I'm Mike Hughes. We'll see you next time on Medically Speaking.